Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. Today we're going to talk about pediatric asthma, and common environmental causes. Children, especially those under the age of 5, wheeze and have asthma symptoms. Some develop persistent symptoms and are diagnosed with asthma. Asthma is a condition which reduces lung function and may have a mild to major impact on a child's overall health and quality of life. Asthma can be triggered by exposure to tobacco smoke or respiratory infections, or lead to limitations in physical activity, missed school days, and other long-term health consequences. A family history of asthma or maternal asthma are risk factors for the development of asthma, and other factors can be traced to a family's living environment and allergens inside the home. On today's show, we'll discuss the best ways to prevent the development of asthma, reduce indoor asthma triggers, and what we all need to know about maintaining a healthy environment at home. Our guest today is Dr. Elizabeth Matsui. She's one of the leading international experts on environmental exposures and their effects on asthma and other allergic conditions. Dr. Matsui is a professor of population health and pediatrics and associate director of the Health Transformation Research Institute at Dell Medical School at the University of Texas at Austin. She is a pediatric allergist and immunologist and epidemiologist who has studied the impact of housing-related environmental exposures on the health of children in Baltimore and other cities. Welcome to our show, Dr. Matsui.
Thank you for having me.
First, tell us about how you got into this work and give us an idea about what's your why.
So this is an interesting question because I don't think I quite understood how I got here until I started thinking in retrospect. So I had pretty bad asthma as a child. And so I know what it's like to struggle to breathe. And during that time, there were some asthma medicines, but they didn't work very well. And a main driver of my asthma was pet allergen exposure. I got pretty sick, although I was at home, probably should have been hospitalized. And as I went on to medical school and then did a pediatric residency, I started to understand there are many kids who struggle to breathe, and their environments are major factors, and they often don't have the ability to control their environments. So whether it's because the trigger has not been identified or that they have minimal control over their environments. And so that is my why, because in 2024, no child should really ever be struggling to breathe.
Thank you. Tell us about the most common environmental triggers that lead to the development of asthma in pediatrics.
So there are two, I think, sort of distinct questions. There's one about that you are asking very explicitly, which is, are there exposures that can cause a child to develop asthma? And then are there some exposures that can trigger symptoms or an exacerbation, meaning a serious attack in someone who has asthma? And the answer to both of those is yes. The answer to the first question is a bit murkier and is scientifically very interesting, but not very informative in terms of like what action someone could take. And the first one is about what can influence a child's risk for developing asthma in terms of indoor exposures. Well, the research suggests that more exposure to certain things like pets and other types of animals, even farm animals, may be protective. But we're not recommending that people go out and acquire farm animals, for example, because we don't really understand whether what we're observing in these studies would translate to some sort of intervention and how impactful it would be. So there's not much that can be thought of in terms of what could be done to prevent, except for one thing that I will emphasize, which is air pollution is known to be a trigger, and the main indoor air pollutant is smoke exposure. And so not having anyone in the home smoke, which means quitting smoking or instituting a home smoking ban, is the major actionable thing that a family can do to try to prevent the risk of their child developing asthma.
Thank you for that answer. Are there critical windows of exposure during a child's development when they're most vulnerable to those environmental triggers?
So the first year of life is the time that they're most vulnerable to exposures that can shape their risk of developing asthma. Beyond that, once they have asthma, then they're vulnerable at all times to allergen exposure if they're allergic to that allergen, or pollution exposure, or respiratory viruses. They're vulnerable to those in terms of risk of causing asthma symptoms or a severe attack that lands them in the emergency room.
Is having respiratory viral illness during those early years of life, if we were to be able to protect somebody with that, help?
So that is a really important question that the field has been going after, and we do see clearly that respiratory virus in the first few years of life is a risk factor, and people have heard of RSV. RSV in particular is a risk factor for a child going on and continuing to have asthma at school age. The studies that have studied different types of pharmaceutical interventions to prevent RSV, we thought that would translate to prevention of asthma, have not really entirely panned out. It's still not a good thing to get, these viral infections. I'm not at all advocating for that, but I think what I'm saying is we still don't have the tools to majorly influence the risk or decrease the risk of someone developing asthma, except for avoiding secondhand smoke exposure.
How has the prevalence of childhood asthma changed in recent decades? I know you mentioned that you yourself had asthma as a child. I have family members who have asthma and were particularly more impacted as children. Talk about that.
So the prevalence continued to increase for quite a while until the last 5 or 10 years. And so it's sort of settled out around 8%. Mm-hmm. So 8 out of 100 children in the U.S. have asthma. Mm-hmm. You can go to different neighborhoods, communities, and that number can vary quite a bit. And so it's as high as 15+% in Black kids. Mm-hmm. Mexican American kids have a low prevalence of asthma, but and historically the prevailing view had been that they have a low burden of asthma. And it turns out that they're the only group with an increasing prevalence of asthma over time. And so their prevalence is now closer to 7%. And among Mexican American kids who do have asthma, they have the same burden of symptoms and exacerbations or serious attacks that Black kids have. And both of those groups have a much higher burden than their white counterparts. So the disparities are very much persistent, and we have not made much headway there.
So is that happening, you think, because of some environmental factor that we've already talked about?
So no one knows the answer to that question, and we are just starting to try to pursue that question. And it's really because we have just started to identify that this population that we thought was not at higher risk, it turns out is at higher risk. And there are all sorts of reasons that you could think of that I think are very plausible reasons as to why that might be. Mm-hmm. But we have really little research into the question to understand why.
Need to keep on doing the research.
Yeah.
How do housing conditions in particular affect children's chances of experiencing asthma-related problems?
So it's very clear that poor housing conditions over and over and over again have been linked to asthma problems in kids. And we also know a little something about the specific types of housing problems. And these specific types of housing problems include pest infestations, indoor air pollution exposure, and then water damage and mold. Mm-hmm. And what is one of the major questions or tensions in terms of understanding the role of housing, it's been hard sometimes in the past to tease apart the housing conditions from, say, poverty as an example. So is it really that if someone has not many socioeconomic resources, that they have poor healthcare access, or is it really the housing, because those things go together? And we had a study that took place in Baltimore and is ongoing, where children with asthma who were enrolled in what's called a housing mobility program. So their families were eligible for federal housing vouchers, and they wanted to move to opportunity neighborhoods. So they moved from highly disadvantaged neighborhoods with concentrated poverty in Baltimore into opportunity neighborhoods that were much better resourced. All of the kids in the study were Black, and they had massive improvements in their asthma when they moved. So nothing about who those kids were changed. The only thing that changed was their housing and their neighborhood. And they had larger reductions in asthma problems than what we see with kind of standard asthma medication. And so that really, I think, puts an exclamation point on environment as a major driver of asthma problems in children.
It sure does. What are some practical steps that we can take to reduce exposure to asthma triggers at home?
So we talked about air pollution that's indoors, so no smoking, home smoking bans. This really includes combustible cigarettes as well as e-cigs, other things that are smoked. And that's the number one thing you can do to lower air pollution in your home. Other steps that can be taken to lower air pollution are having a high performance filter in your HVAC system. And so essentially, and I needed to have my engineering colleagues explain to me how this worked. If they're filters, your HVAC system is pulling air in from outdoors, and the air passes through those filters, but it also gets recirculated in the home, and those filters trap particles. Sometimes if you're cooking, that's a major source of indoor air pollution. You want to turn the vent on, but you want to make sure that the stove is vented to the outside. In some cases, the vent does not go outdoors, and then you're just depositing air pollution back indoors. And in some cases, portable HEPA purifiers can be helpful depending on the circumstances. And then we shift to allergens. So the important thing about allergens is to understand what your child is allergic to, because if you have a cat in the home and your child's not allergic to a cat, it's not useful to try to do anything to reduce cat allergen exposure. But for animal allergens, all allergens are microscopic, they're airborne, and they're sticky. So they stick to walls and furniture and clothing. And so I did not do these studies, but colleagues of mine did studies where they restricted the pet to one area of the home, had the bedroom of the child be a safe space, door shut, running air purifiers in the bedroom, and you can lower the pet allergen level by a tiny amount. And it's because the pet is like a biologic factory of allergen and produces it at a much greater rate, and it goes everywhere, then you can try to clear it out of the home. But sometimes those measures can help. Pest infestation, taking an integrated pest management approach can be helpful. Simply just bombing is not very helpful, and then you're also increasing exposure to pesticides. And so for cockroaches, using gel baits has been shown to be effective, and sealing up holes and cracks where pests can come into the home. In some cities, mouse infestation is endemic. It's not as much so here, but setting traps is also helpful. And then making sure there are no food or water sources for pests. So lids are, on trash cans, and crumbs are picked up. And then there are dust mites. And we can talk about those if you want to hear more about dust mites, and then mold as well. Yeah, and dust covers on pillows and mattresses, and limiting stuffed animals and that sort of thing. All of that, right. And so dust mites, so sometimes patients love to hear this story. They eat the skin flakes that we slough off. Both of us in a room are leaving our skin flakes. And so the place where the skin flakes are most concentrated is in bedding and upholstered furniture. And so that's why there are a lot of dust mites there. So washing all of the bedding, comforter, blankets in the hot water cycle every 2 weeks at least removes them from the bedding, but they're still inside the mattress and the pillows. And so allergen impermeable or proof mattress and pillow encasements are sort of like putting your mattress and pillows in a Ziploc bag. They're much nicer than that plasticky feeling. You can get some that are more fabricy feeling, and they trap the dust mites in there to reduce exposure to them.
Thank you for that. What would you say are some of the promising directions that research is heading in to better understand how we can prevent and treat environmentally induced asthma?
So I think about this in terms of what can be done at the household or family level, what can be done at the community level, for examples in schools and neighborhoods, which I think you alluded to, and then what can be done at the policy level. And for families, we know what the triggers are. And so the research really needs to focus on understanding how to more effectively address these exposures. So we've had one study after another that has not worked well when we've tried to just simply go into a home and provide resources or assistance for addressing a particular type of exposure like pest infestation. And oftentimes that's because it's not just that one home. So in some neighborhoods, in some cities, for example, pest infestation is endemic. So you can intervene in one home and it doesn't matter because the home is in a certain context. But we need to understand how to do that better. At the neighborhood or school level, we need to understand how we can intervene in schools. And I think there are lots of opportunities because there are air quality problems in schools that are similar to homes, and it's the same sort of triggers in school settings as well. And because of that study I just talked about, we know that neighborhoods matter. And certainly it doesn't make sense, nor do people want to move from their neighborhoods. So while that study of moving was informative, it is informative in that it tells us we need to figure out how to improve neighborhood settings so that we have less air pollution, we do not have conditions that promote pest infestation, and so on and so forth. And then at the policy level, this is really hard to do, but if you have the ability to measure the burden of asthma at the neighborhood level, you can imagine that there may be things that could be done to understand whether policies related to, for example, housing code violations or something like that have made a difference, in a particular community. Tree planting, exactly.
How can communities advocate for policy changes to reduce environmental triggers and protect our children's respiratory health?
So the number one thing that we can do is vote.
Yes.
Because the people we vote for are the people who are making decisions on our behalf. Mm-hmm. The other things that we can do are connect with community organizations that are advocating for policy changes, and that can range from neighborhood associations all the way to national organizations that are advocating for policy change.
As we both know, there's a lot of misinformation out there, and I would just like you to give in your opinion, what are some of the best resources for information that people can go to after they've heard what we're talking about today, pediatric asthma and asthma in general?
Yes.
To really get the correct information on what they need to know.
I think so. There are many, many resources that are available from a range of organizations. I'll start with federal agencies. So Housing and Urban Development has resources on their website, the EPA, the CDC, the NIH, and then there are also national organizations like the American Lung Association, my professional society, the American Academy of Asthma, Allergy, and Immunology, the American Thoracic Society, and then there are local organizations. So if you go on the Austin Public Health website, there are lots of resources there. There are resources for smoke and e-cig free events. There are instructions about how to report violation of the smoking ordinance. There's a health equity unit with an equity line that people can call. And there are also air quality resources. We know that, I know we're talking about housing and indoor exposures, but air pollution that's outside gets inside. And the EPA and airnow.gov provide air quality reports daily.
Thank you. So could you talk to us a little bit about why it's so important for people to have their vaccines for our vaccine preventable viral illnesses like RSV, COVID, and influenza?
Because they cause an untold amount of morbidity and mortality. And so what do I mean by that? The range of effects are from missing school and missing work days and feeling miserable. But we have many, many people who are hospitalized every year from those, and people die, and actually children die even from influenza. And oftentimes I think it's not well appreciated that we do have really severe outcomes. And so vaccines are an incredibly effective tool at preventing, serious consequences from these viral illnesses.
And I'd be remiss if I didn't put a plug in for vaccines.gov for people who are looking for a vaccine provider here locally. You can also go to your local provider, local pharmacies, or visit Shots for Tots or Big Shots for flu vaccine and COVID vaccine for children at Shots for Tots, and flu vaccines for our adult listeners who are uninsured. I want to thank you for that answer, Dr. Matsui. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.